So welcome all for the today's introductory session for MRCOG Part 1. So now we are aiming at January 2027 examination. We begin with our quote, Master MRCOG with concept-oriented clarity. So in this session, we will have the overview of MRCOG as such, what are the different parts of the MRCOG and how to prepare for the first part, that is the part 1 of MRCOG. Okay. So basically learning objectives for the today's session are, as I mentioned, to take the overview of MRCOG along with its three parts, part 1, part 2, part 3. Then there are a few important steps when you want to decide to go ahead with the MRCOG. The first and very important step is a creation of the trainee's account on the RCOG website. Something like taking admission to your PG course, okay, or getting admitted to a medical college. So you need to create your trainee's account on the RCOG website. Once you create a trainee's account, you get a 6-digit RCOG reference number, and this 6-digit RCOG reference number is very important throughout your career. This number is constant, and you need to use it for your part 1, part 2, part 3, and even if you clear for part 1, any correspondence with the RCOG will be through this 6-digit number, and it will be unique for you. Okay, so this you have to do. Second, you have to send an application for the part 1 eligibility. Okay, so application for eligibility for part 1 of MRCOG. This is a very important step, and you have to send the expression of interest for appearing for the part 1 examination. Okay, so for these three things, there is a separate video which I have already created. I'll be giving the link for this particular video, and you will understand step by step how to create an account, and this is totally free of cost. Okay, so and next stage comes the booking the exam, and you will have to pay the fees only when you book the examination. So registering with the RCOG, creating an account is not requiring any fees. Okay, now we will also discuss about the syllabus and resources for preparation for part 1 MRCOG, and we will discuss about the blueprint for the part 1 MRCOG course, and little bit about the online learning we are going to see, and how the course will go, that will also discuss. Okay, so something about this Royal College of Obstetricians and Gynecologists. This Royal College of Obstetricians and Gynecologists is situated in London, United Kingdom, and this is established in September 1929. The first president of this college was Professor Blair Bell, and honorary secretary was Professor Fletcher Shaw. Current professor from December 2025 onwards is Dr. Ellison Wright. So let's see about this MRCOG overview of this membership of Royal College of Obstetricians and Gynecologists. So this particular qualification is basically designed for testing the skills, knowledge, and clinical behavior of the doctors specializing in obstetrics and gynecology. The MRCOG qualification, as I have already mentioned, has got a three parts, part 1, part 2, and part 3, and successful completion of all three stages is required for membership of the college to be awarded. So once you clear all three parts, then the college will arrange a ceremony and you will be awarded the membership of the Royal College of Obstetricians and Gynecologists. Okay, then why should we do the MRCOG? Should we do it? It's up to you, but let's see the advantages. Okay, first thing, it will give you an additional qualification with the same kind of training which you do in your own country. This qualification is internationally recognized. It is a gold standard qualification in obstetrics and gynecology. Once you have this international qualification, many international job opportunities will open for you. It will help you for migration. You may be able to go to Middle East. You may be able to United Kingdom for your practice and all. Okay. Even if you don't want to migrate, even if you don't want to work in international other countries, even if you work in your own countries, your practice will always be evidence-based practice. Okay. And nowadays, even the corporate hospitals, many corporate hospitals have started recruiting the people with this international qualification. So this particular qualification is going to be very important. It will give you the practice your obstetrics and gynecology in an evidence-based manner. Then can I do it? Okay, so should I do it is up to you, but can I do it? So let's see. Most of the people are either resident or they are having their own clinical practice. They have completed post-graduation. So can I do it? Basically, that is the main question. Okay, so basically you can complete this MRCOG along with your existing career pathway. Even if you are a resident doctor or even if you are a clinical professional, you can do it. Okay, so our flow for education is you complete your MBBS, then you take a admission to your post-graduation course, that is MS or DNB, and then you start the clinical practice. Okay, but this MRCOG can run alongside your existing pathway. Okay, so this will give you an additional international qualification, and concept oriented learning will be there. There is no need to leave your residency or job, and there is no need to visit UK also to give this particular examination for any part of this qualification. Okay, so you can build your qualification progressively. Now, what is the challenge? Basically, time is the main challenge for everyone, whether you are a professional, working professional, or whether you are a resident doctor. The real challenge is the time. For resident doctor, you have busy ward work, operation theaters, labor room duties, academic work, and simultaneously you are preparing for your thesis, MS or DNB examination. But if you integrate this MRCOG curriculum into your postgraduate curriculum, because 90% syllabus is same, the same topics are there. Okay, so that you can work it out. Same is possible for the practitioner also, because practitioner will have the OPD, operation theater, labor room duties, emergencies, and the most important is a family commitment. This is always 24/7. And if you want to do MRCOG, definitely it becomes how I am going to manage. But this challenge also you can integrate in your day-to-day clinical practice. You can take the advantage of that, because all the guidelines and application of these guidelines and communication with the patients you can do daily in your practice, and automatically it becomes an easy. So therefore preparation must be smart. Okay, because you have so many responsibilities, so it should not be a long preparation, it should be a smart preparation. Okay, and you should integrate this MRCOG curriculum into your existing curriculum. So basically the courses which we have designed, they are around the reality of your professional life, and not around the assumption that you are a full-time MRCOG student. You need not be full-time MRCOG student. You can do along with your practice, you can do along with your residency or post-graduation. Okay, so the next question comes in mind: when to appear for this examination, when to give part 1, when to give part 2, etc., etc. Okay, so most important thing is that there is no age limit. You can take the MRCOG at any stage of your career journey. Okay, so there is no age limit. If you are a trainee doctor in residency, then you can plan your part 1 of MRCOG generally within first 12 to 18 months of your starting your training. Okay, because you have recently cleared your MBBS, you have appeared for your NEET examination, and then you have got your admission to your postgraduate course. So once you get settled in first 12 months, then you can start definitely thinking about this MRCOG, because most of the subjects which are there in part 1 of MRCOG are preclinical and paraclinical, and you are relatively fresh with the knowledge. So this is the right time to start the preparation for the part 1 of MRCOG. Then you should appear for second part of MRCOG. Okay, so part 2 generally you should appear at least 36 months of training when you have solid foundation of clinical experience. This is not mandatory. You can appear immediately after part 1, but if you see the depth of the examination, the kind of questions which are asked, the what the RCOG expect from you in this second part is basically that is possible to clear when you have seen a variety of patients. Okay, so better to have at least 36 months of training and build your solid foundation, and then you appear for part 2. And part 3, you need to clear your part 1, part 2, and you should have minimum 4 years of training in obstetrics and gynecology. That is eligibility for your part 3. Okay, so what matters most is your readiness. That matters most. Okay, so it depends upon your clinical acumen, it will depend upon the exposure and how well read you are during your day-to-day practice. Okay, so that is what decides when to appear for part 1 and part 2. So these whatever I have said, just in general I am mentioning about it. Okay, so many candidates succeed by studying alongside their clinical duties, turning everyday patient encounters into valuable learning. Okay, so the key is a consistent preparation, confidence, and timing that aligns with your personal and professional growth. So consistent preparation is very, very important. You have to be always positive, and this is a very much doable examination. Okay. So coming to the structure of the MRCOG, what is there in part 1, part 2, and part 3 examination? Okay, so the MRCOG part 1 will cover the basic and applied sciences which are relevant to the clinical practice of obstetrics and gynecology. It is a computer-based test. Okay, So second part will assess the application of your knowledge in various clinical scenarios. It is also a computer-based test. Okay, but part three is a clinical assessment of your knowledge, skills, attitudes, and competencies. It's an OSCE examination, that is objective structured clinical examination. It has got a 14 stations and various domains will be assessed that we'll be discussing subsequently. Okay, so once you are past the part three of examination, that leads to the award of the membership of the college. And remember, there is no part membership which is awarded by the college. So once you clear part one, it's not good to write MRCOG part one. If you clear part two, it's not appropriate to write part two of MRCOG. Okay, you complete all three parts and you can use this title as or this degree you can use it. So basically, how to register with RCOG. Okay, so this is very simple. You have to create a trainees account on the RCOG. Okay, this is definitely free of cost. You can create in your trainees account. Okay, most important thing is that for getting this qualification, you don't have to apply for any competitive examination like NEET, or you don't have to have. You should be trainee in obstetrics and gynecology in your own country. Okay, you should have an adequate experience in obstetrics and gynecology. Okay, so once you create your trainees account, you will send application for assessment of your eligibility for the part one of examination. Then you will send the expression of interest, and when you want to appear for the examination, at that time you will pay the fees for the examination. Okay, so if you see this MRCOG journey, basically the creation of the RCOG account that I have already mentioned, where you will get a 6-digit number. Then you will confirm your eligibility. You will send an application for the eligibility confirmation. Generally, it takes 4 to 6 weeks. Okay, so how to do it, that you can watch in the video. Second, once you appear for part one, you will clear your part one of MRCOG and your training will continue. Okay, so before appearing for part three, you need to complete total 4 years of training. Okay, so once you have cleared your part one, you can appear for a second part of the examination, and then you will get a part two result. And after part two, then you will apply for the third part, that is part three of MRCOG. But before you appear for part three, you need to complete the required training criteria, which is nothing but the 4 years of training in obstetrics and gynecology. And most of your post graduation requires either 3 years or 4 years of training. 3 years of postgraduate training is totally will be recognized. Along after that, most of you do senior residency or work as a specialist in government service. That will also be recognized for this. And during your residency plus your senior residency, you can complete this 4 years of training and you can appear for the third part of the examination. Okay, so before you appear for third part, there is a one application procedure called as assessment of training, where you will apply along with your training certificate that I have got an adequate examination, adequate experience. Okay, that is the 4 years. So after passing part one, and once you have completed the required training, you will be able to apply for the assessment of the training. There is no need to wait for the second part. Okay, for postgraduate exam residents, actually it is just one subject which you are studying for your PG, and you have to give 2 examinations, that's all. Okay, and you get a 2 degrees totally. Okay, so coming to the eligibility, as I mentioned, you will be applying for the part 1 of the MRCOG examination, and for the eligibility you need to be MBBS from the recognized medical college. Then you need to send the eligibility application to the RCOG. This is an online application procedure, and what are the documents which are required, that I have discussed completely in the separate video. Okay, basically you need a medical degree and the registration certificate. Your first name and the last name should match with the degree certificate. Then the response time is generally 4 to 6 weeks. Expression of interest can be done before you get your eligibility confirmed. But when you apply for examination, at that time your eligibility should be confirmed. Okay. Then coming to the part 1 MRCOG examination. Okay. So as I already mentioned, this is a computer-based test. You will have 2 papers. Each paper will have 100 single-based answer questions. Both papers will contribute equally to the final score. So paper 1 will be duration will be 2.5 hours, and that is 150 minutes, and you will have 100 single based answer questions. Paper 2 will also be of 2.5 hours, that is 150 minutes, and you will have 100 single based answer questions. Okay, so there will be lunch break of 1 hour between the paper 1 and paper 2. So total it is a almost 6 hours of examination, 5 hours plus 1 hour of lunch break. So you need to be very much patiently sitting in front of the computer and solving this SBAs. Okay. So if you see this particular example, what kind of questions are asked? It's not multiple choice questions. In multiple choice questions, what happens? You are given one question, which is just a stain, and you are given 4 or 5 options, out of which one is correct and others are wrong. But here, when you see this single best answer question, you will find that more than one answer appears correct. They may be correct, but there is only one answer which is best and which is correct. That you need to find it out. So for example, this look at this particular question, read this particular question. A 24-year-old presents at 27 weeks in her second pregnancy, feeling unwell, backache, fever, and rigors. She has got a temperature of 39.5 degree, and urine analysis shows leukocytes, proteins are 3 plus. Her blood pressure is 80/50. Which action is most appropriate? Okay, now the option which is given is one, she requires admission to the ICU HDU for IV antibiotics and supportive care. Second option is arrange for ultrasound of the renal tract. Third is a commence 7-day course of oral antibiotics. Fourth is give intramuscular steroids to promote fetal lung maturity. And fifth is a make referral for physicians to review. Now, once you read this particular question, what you understand is she is a 27 weeks, she is unwell, and she has got a fever. Okay, the urine analysis is showing some infection. Okay, blood pressure is on lower side. Okay, so you may interpret that she is having urinary tract infection and she will require treatment of urinary tract infection. Someone may think she is a 27 weeks and she might go in a preterm labor, so she'll require IM steroid dose. But you read the complete scenario and you come to a conclusion she is a 27 weeks with features of sepsis. She has got a fever, 39.5. Most probable source is a urinary tract infection. The infection is such a severe that her blood pressure is dropping down. So what is going to be the most in her case is that she requires ICU HDU admission for IV antibiotics and supportive care. So your these answers may be partly correct, but the most appropriate in this scenario is going to she will require admission to the ICU, HDU, IV antibiotics and supportive care. This is going to be the best and correct answer for this particular scenario. So your understanding from this particular question, they are going to test. Okay, so that is what makes this particular examination little different from our traditional examination, and your preparation should be in that particular format. Now coming to the second part of MRCOG, part 2 is also computer based test. It will also have 2 papers. They will contribute equally, that is 50% to the final score. So single best, there are 2 types of question. In part 1, what we discussed, there were only single best answer questions. Here, there are 2 different types of question. One is a single best answer questions in which you will have 5 options. Okay. And another is a EMQ. EMQ will have 12 to 15 options. Okay. Many options are there, out of which only one is correct. Okay. So even if there are in one paper there will be 50 SBAs and 50 EMQs, there is no equal weightage to these SBAs and EMQ. There is a maximum weightage to the EMQs. So 60% of the marks will be taken into account from your EMQ score, and 40% marks will be taken into account from your SBA score. Okay, so more weightage is given when they calculate the total score. More weightage is given to the EMQs, and solving these EMQs takes long time. Their level of difficulty is different. Okay, so that is why the most of the candidates find this part 2 is very difficult. Okay, but basically you understand the technique that we will discuss. So there is no separate pass mark for SBA and EMQs. A combined pass mark is determined through a standard. So every year the standard for passing is different. The SBA component is contributing to 40% of the overall marks, and the EMQ will contribute to around 60%. So more weightage is given to the EMQ in second part, while in part 1 of examination you will only have the single best answer question. Okay, So coming to the second part, the exam structure for the part two. So for part one, we have discussed there are 100 questions. Here also there are 100 questions, but paper one is of 3 hours instead of 2.5 hours. You will have 180 minutes, and paper one will also have 50 SBAs and 50 EMQs. Paper two will also have 3 hours of duration, 50 SBAs and 50 EMQs. There will be lunch break. So this is also a long examination in one day, conducted simultaneously in many centers across the world. Okay, so time management is going to be very important because SBA may take little less time, but EMQs take longer. So it's basically you take 70 minutes to solve these questions and around 110 minutes for the EMQ. That is what out of 3 hours you distribute this particular time in this particular way. Okay, just approximately 1 minute for SBA and around 2 minutes or less than 2 minutes for each EMQ you should spend. And this you need to practice. Then only you will be able to finish your paper. And most of the people find EMQ difficult because understanding the technique is important. Okay, now coming to the third part of the examination. So here it is an ASCII, that is objective structured clinical examination. You'll be given 14 different tasks, and these 14 tasks, they will be mapped to one of the 14 modules. So this whole syllabus is divided into 14 modules, and from each module they'll be taking out one task. Okay, and there are different domains which are assessed in each and every task. Basically there are total 5 domains they assess in the third part. One is a patient safety, second is a communication with the patients and relatives, third is a communication with the colleagues, next is the information gathering, and fifth is the applied clinical knowledge. These are the 5 main domains, out of which 3 or 4 domains are assessed in each task. Okay, so every station will be corresponding to one particular module, and there are total 5 domains, out of which 3 to 4 domains are assessed in each station. Okay, so balanced performance across all domains is essential. So when you want to pass, no, you should have the not only the applied clinical knowledge, but you should know how to take the history, how to interpret the result, how to communicate the relative those report to the patients and the relatives. Okay, so all these privacy, confidentiality, everything, communication with the colleagues, whether you are informing appropriately to the your seniors, involving the different specialties or not, you are assessing the risk. This is all tested in the part 3 of the examination. Okay, so actually we are doing lot of clinical work, and simultaneously if you learn these particular techniques, it will definitely help you to grow in your clinical practice also. Okay, so basically this slide, which I always show to all my students in all my presentation, before you start anything, learn how to finish it. Okay, not like this particular person who has started the painting, but he does not know how to end it. And this is what happens with most of the MRCOG candidates. They start preparing, but they don't know how to finish it. Because as I mentioned in overview, there is a part 1, part 2, part 3, but every part has got a different techniques, there is a different way of assessment. So your preparation should be different for part 1, different for part 2, different for part 3. Okay, the same kind of preparation you cannot have for everyone. So understand what kind of technique is required for each examination. Okay, now let's see the structure of the examination. Okay, as I have mentioned that there are 2 papers. The paper 1 will have mainly the anatomy and embryology, physiology, biochemistry, endocrinology, epidemiology and biostatistics, and genetics. So there will be 100 SBs which are mainly on these particular modules, while paper 2 will also have 6 modules, mainly the pharmacology, microbiology, immunology, biophysics, pathology, clinical management, and data interpretation. So looking at these particular subjects, you will realize that these are mainly paraclinical and preclinical subjects along with some clinical component. But does it mean that you have to know whole of the anatomy, whole of the physiology, what you have learned in your first MBS? No, basically the obstetrics and anatomy and physiology, biochemistry, which is relevant to the obstetrics and gynecology, that will be asked. Okay, so they will not be asking you about the foramen of the skull. They will not be asking about the arches of the foot, but definitely the skull pelvis will be definitely asked. The anatomy of the skull, anatomy of the pelvis, definitely you will be asked. So anatomy, physiology, biochemistry, endocrinology, which is relevant to the obstetrics and gynecology, that is asked. Okay, so let's see the weightage. We should know the weightage because our time allotment will depend on the how much weightage each subject is having. Okay, so anatomy and embryology carries the maximum weightage around 30%. Okay, so 25 to 37 questions are there from anatomy and embryology. Physiology around 12 to 15. Biochemistry, endocrinology, they will have around 10 questions, 8 to 11 questions. Epidemiology and biostatistics, most of the students find it very difficult, but there are more questions from this particular topic. Around 12 to 15 questions will be there. Okay, but I'll tell you, this is the most scoring because there are only limited number of concepts which are expected from you. And if you understand those concepts clearly, this is like a mathematics. Okay, so genetics will have around 8 to 11 questions. Then paper 2 will have pharmacology, around 12 to 15 questions, microbiology, immunology, microbiology around 16 to 18 questions, immunology around 13 to 15, biophysics around 10 to 12, pathology around 15 to 17. Clinical management and data interpretation is also very important. Here you'll be given some report, maybe CTG will be given, maybe ABG report will be given, and you are supposed to make a diagnosis or interpret that particular result, come to a conclusion, or mention the appropriate management. Okay, so how you interpret the data which is given to you, and this is around 25 questions will be there. Okay, so basically, what are the different concepts which are tested in different modules? Okay, so anatomy, here commonly tested concepts are the anterior abdominal wall, anatomy, muscle actions, nerve supply, blood supply, inguinal canal, femoral canal, inguinal hernias, brachial plexus anatomy and relevant injuries, anatomy of the pelvis, pelvic diaphragm, pelvic blood vessels, ureter, tubes, ovaries, their blood supply, nerve supply, etc., fetal skull, issue fossa, perineum, vulva, vagina. These are the commonly tested concepts in the anatomy. Okay. In embryology, gametogenesis, fertilization, implantation, first 3 weeks of the development, that is the general embryology. Concept of gastrulation, neurulation, somites formation, development of the organ system, that is systemic embryology, in which cardiovascular system, reproductive tract, renal system development, CNS, GIT development, pharyngeal arches. These are the different concepts which are tested. Okay, so the same what we have discussed before. This is the pie diagram for paper 1 and paper 2, showing the percentages of the. So thing is that even if you find these different modules, there are certain modules every candidate might find different modules are difficult for them, but you cannot keep any module for the option. Okay, you have to prepare for all the modules if you want to clear. Okay, there is no passing as such, but your score will be definitely in the pass range when you attempt all the modules. You cannot skip any module. Okay, okay, it is not a mandatory as such, but what I mean to say, your score will be better. The physiology, generally you will have 10 to 12 SBAs. The commonly tested concepts are the acid-base balance, physiological changes in pregnancy, very frequently asked, especially the cardiovascular, respiratory system, GIT, genitourinary tract, etc. Calcium homeostasis, physiology of labor, menstruation, ovarian cycle, placental physiology, very frequently tested. Fetal circulation, you should know. In endocrinology, hypothalamo-pituitary axis, role of hypothalamic and pituitary, anterior pituitary, posterior pituitary hormones, thyroid hormones, adrenal hormones, placental hormones, hormones which are involved in puberty, menopause, infertility, labor, lactation, etc., diabetes mellitus. So these are the frequently tested topics from the endocrinology. Biochemistry, most frequently asked questions are around carbohydrate, lipid, and protein metabolism. Krebs cycle, every examination there will be questions. Ketone body formations, amino acid pool, essential and non-essential amino acids, role of proteins, glycogen storage diseases, digestion, absorption of various macronutrients, urea cycle, vitamins, liver function tests, renal function tests. These are expected from the biochemistry module. While pathology module, general pathology topics like cell injury, wound healing, neoplasia, coagulation abnormalities, blood transfusion, shock, various obstetrical disorders like preeclampsia, eclampsia, HELP, acute fatty liver of pregnancy, gynecological conditions affecting the genital tract, both benign and malignant conditions involving the ovaries, tubes, cervix, uterus. Remember, pathology carries a lot of weightage. Around 15 SBS will be there. Okay, and you need to know different histopathologies of different malignancies also. Okay. Then coming to the pharmacology, around 10 to 12 SBs are there, commonly used drugs. Day to day, we are using these particular drugs, so we should know the pharmacology of these particular drugs. Okay, so oxytocics and tocolytic agents, anticonvulsants, antiepileptics, antiasthmatics, anti-cancer agents, antibiotics, oral contraceptive pills are very frequently asked. Drugs used in abortion, teratogenicity of the drugs, that is very favorite of RCOG, anticoagulants and biological agents. These are the drugs or the topics from the pharmacology which are very important. Biophysics, the here various concepts which are tested are from electrosurgery, electrocautery, types of current, sonography, and various special investigations such as CT scan, MRI, laser, etc. Radiotherapy, there are many questions from chemotherapy, radiotherapy, etc. Okay, genetics, most of the students find it difficult, but you understand the concept and work on those concepts, you will score a lot. Okay, so the concepts which are tested in from the genetics are Mendelian inheritance, autosomal dominant, autosomal recessive, X-linked inheritance pattern, then non-Mendelian inheritance such as mitochondrial inheritance and genomic imprinting. Then prenatal genetics and diagnosis, pre-implantation diagnosis, various non-invasive prenatal testing, NIPT, then invasive tests like chorion villus sampling, amniocentesis, and various tests like maternal serum screening for quadruple test, combined test, etc. Pre-implantation genetic testing for aneuploidy, monogenic disorder, structural rearrangements, these are also tested. Chromosomal abnormalities, numerical abnormalities, various aneuploidies like trisomy 21, 18, 13, these are very frequently tested. Okay. Then microbiology, various bacterial infections. The commonly asked are the group B streptococcal infections, listeriosis, syphilis, viral infections like torch, HIV, Australia antigen, parvo B19, fungal infections like candidiasis in pregnancy, toxoplasmosis, that is a parasitic infection. Sexual transmitted diseases are also very frequently asked, such as chlamydia, gonorrhea, mycoplasma, HPV, HSV, HIV in pregnancy. These are frequently asked topics from the microbiology. From immunology, there are around 8 to 10 questions. The questions are based mainly around the innate immunity and adaptive immunity, components of the innate immune system, components of the adaptive immune system, such as T cells, B cells, antigen presenting cells, cytokines, their role in the immunity, and other concepts which are from tested from the immunology are the immunological aspects of pregnancy. Okay, so maternal fetal immune tolerance, role of the placenta in immune regulation, changes in maternal immunity during pregnancy, immunopathology of pregnancy-related conditions like recurrent miscarriage, preeclampsia. Okay, hypersensitivity and autoimmune disorders are also very frequently asked. So types of hypersensitivity reactions, always there is a question. Then autoimmune diseases which are relevant to the obstetrics and gynecology, antiphospholipid antibody syndrome, lupus anticoagulant or SLE is very frequently asked. Immunology of infection in pregnancy, immune response to infections, vaccination principles, and various vaccines which are used in pregnancy like influenza, pertussis, COVID vaccines. These are also very frequently asked from the immunology. Okay. Biostatistics, as I mentioned, most of the students run away from the biostatistics, but mind you, this is a very scoring, and we do go into the details of this topic, and most of the students do well if they understand these concepts well. Okay, so basic statistical concepts such as types of data like qualitative data, quantitative data, different types of variables like discrete variable or continuous variable, then measures of central tendency like mean, mode, median, measures of dispersion, range, variance, standard deviation, interquartile range, and diagnostic test. Okay, different features of the diagnostic test like sensitivity, specificity, positive predictive value, negative predictive value, likelihood ratios, and various types of statistical tests like chi-square test, t-test, ANOVA test. These are expected from the biostatistics. Next, you have a data interpretation and clinical management. As I already mentioned here, you will be given some kind of report like CTG, then there may be ABG report and all, or you are expected to interpret the screening and surveillance data such as Down syndrome screening test, like combined test, quadruple test, etc. And understanding the risk in pregnancy, relative risk, odds ratio, absolute risk reduction, ABG analysis, ECG interpretation, oxygen dissociation curve, urodynamics, Apgar score. So these are semen analysis. So these kind of reports and their interpretation is expected from this particular module. Okay. So after finishing the scope of the syllabus, let's see the what are the different resources for this first part. There are various books are available on this. These are few of the books like your essential revision guide, MRCOG part 1, Cambridge University Press is there. Then there are revision notes for the MRCOG part 1, Oxford specialty training, pass MRCOG. There are many such books which are available. You can refer to any of these, and most of our notes and most of the this videos, you will find that everything is getting covered. Okay. This is the last year's schedule, but this year's January 27 schedule they have not yet put on the website. Whenever it comes, I will be posting that into the Telegram group. Okay, so these are the fees. If we assume the fees are same like what were there for the January, June, July examination, so they have divided the different countries into different bands, band A country, band B country, band C country. So the fees are different for depending upon your country. Okay. So India lies in band B where the fees is around 601 pound, and to which the GST gets added. So the fees becomes tremendous, maybe around, it may come around 80,000 or something like that. So it's really cost is too much for this examination. But thing is that you prepare well, you will definitely pass this particular examination. So during your preparation, there are certain do's and certain don'ts which you should know. So do's, basically you start preparation with a very positive attitude. Okay, collect all your resources and keep all these resources organized. We'll be discussing many things in our Telegram group, but we'll be going module wise. Okay, so your preparation should be a well organized preparation. Okay, have your own schedule of the study. Okay, focus on the last 5 years recall, and we will have the revision session along with the recall in the, especially in the last month. Then revise your SBS at least 3 times. And there are certain don'ts. Don't wait for the booking for the last. Once the booking window opens, and if you are prepared thoroughly, you book your examination. Okay, so don't leave any topic as an optional topic. No module, no topic can be left as an optional. Okay, so don't revise book for the final revision, just go through the notes at the end. Okay, in the beginning, yes, you have a lot of time to read the books, but at the end, you should use the notes. Okay, don't read till the last minutes. Most of the students do get confused, especially if you read too much also. So your preparation should be practice what is expected in the examination. Don't leave any question unanswered, because there are 100 questions in one paper, and questions of all answers are there in front of you. If you do not know any question, what is going to be the likely answer? There is no negative marking. So don't leave any question unanswered. Okay. Now, how you are going to study? First thing, get used to the e-learning. Okay. Up till now, most of the candidates or most of the students are used to the hard copies of the books. But try and get used to the soft copies, learning through the tablet, mobile, etc. You will follow the schedule and you will always study module wise. You give the time, more time for the modules which will have the high percentage of SBS. We have discussed which modules carry high weightage. You will allot more time for that. Then you should always prepare your own notes, and you should always be active in the group. Don't feel bad or something if you go wrong. Always answer in the group. Even if you're wrong, this is not a final examination, and the topic on which you go wrong, definitely you will be right. You will remember that particular concept very well. Okay, so whatever the task which will be given you, that task you need to complete on time. Like it may be solving of the SBA. There may be some video for watching. There may be some document which you are supposed to read. So do it in time. Okay. Live session will be there on the weekend. So always attend the live session. By any chance, if you don't get time or if you are having some emergencies, the live session will be available in our LMS learning management system through your login. Okay. It will be available till you pass. Okay. Then question bank from the website, will be posting some questions in the website also, and give time adequate. This is very important. Revision is going to be very important. Okay. Concentrate on the recalls, and there will be separate recall session once we finish our syllabus. Generally, we try to finish 1.5 month before our schedule examination, and at least 2 to 3 hours per day you need to study. Last 1 to 2 months, you have to be very particular about the study, and you will be attending periodic mock whenever it will be posted. Okay. There are certain tips and tricks. Though there are tips and tricks, they will work only when you have read the subject thoroughly. Okay. So don't rely only on the tricks. Okay. Read the question carefully, understand the concept, what is expected from you. Okay. So there are certain mnemonics which we keep while learning. They will be told to you. Recalls are going to be very important. You should have your exam wall. You are busy working, you're busy professional, but certain like staging, like different types of histopathologies of different malignancies, you prepare, make notes and put it in your exam wall, from where you can revise in a very rapid way. Okay. Consistency and persistency is very important in your preparation. Yes, mentorship helps a lot, but you can prepare on your own also. But there is definitely role of mentorship that I will be discussing. And always have the group. You should have some study partner, okay, throughout your study, so that you can discuss the things and all. So key for the success is you need to organize your study material. You need to have your own schedule. Okay. Maybe except your emergency days, rest of the days you will find 1 or 2 hours, maybe 30 minutes on certain days, that you need to take out and plan your schedule. Okay. The most important here is a practice of the SBAs. So you need to solve various SBAs from various books, various sources, and the practice of these SBAs is the key to the success. Always have the positive attitude, because there will be some ups and downs. Certain days will be there when you are busy, your schedule will get disturbed, but don't get discouraged. Okay. Do not stop till you achieve the goal, because this is a very much possible. Okay. You understand the technique, because each part has got a different technique. So you understand the technique, and that we will be discussing as our course goes. Then dedication and determination, that matters a lot. Okay. Prepare your own notes, because these notes will be very helpful before your final examination for quick revision. Give adequate time for the revision. So this is the way your exam wall or study wall should look like. And most of the concepts are same for your MRCOG, and for your post graduation, 80% syllabus is same. Okay. So when I think about this journey of MRCOG, this is something like, preparing for a trek to Mount Everest. This is not that easy. What I have discussed, it's not that easy. Okay. There are different parts, they are expecting different concepts. Okay. So it's like preparing for a trek for Mount Everest. So it's demanding, complex, and full of unexpected challenges. Without right guidance, and even the most determined candidate can get lost and exhausted and overwhelmed. Okay. So you need to be not only determined, you need to have a right guidance also. And here comes the role of the mentorship. If you see these two fellows, who are they? They are this one is the Edmund Hillary. He is a New Zealander, and this is the Tenzing Norgay, a Nepali Indian Sherpa. Okay, they were the first climbers which they were confirmed to have reached the summit of Mount Everest, which is the world's highest peak, on May 29, 1953. Okay, so this particular person, the Nepali Sherpa, has definitely helped, and it is a journey together. Okay, so your mentor will always be there with you. Okay, so basically mentor's job is to give you the proper guidance. You wouldn't attempt Mount Everest alone. You will always need some guide. So you should not attempt prepare MRCG alone, because your mentor will always plan the route for you. Every candidate's issues are different. Every working professionals issues are different. Residents issues are different. Okay, so there will be creation of the tailored study strategy and schedule. There are certain camps which where you need to take rest, that is decided by the guide. So set up the camps, identify the milestones, foundation topics. So different concepts may be very difficult for different candidates. Okay, they will alert you to the dangers, like which are the weak areas, what are the exam traps, the misconceptions, that will be guided by the mentor. Then provides the safe rest points, encourages active revision and recovery, and keeps you going till you reach the summit, that is the exam day. Okay, so that is what is the role of MRCG. And once you clear your all three parts of MRCG, this is the award ceremony of MRCG. Even this ceremony is conducted in various countries, and for this also you don't have to visit the UK. Okay, and definitely you will be one of them once you clear all three parts. Okay, now how the academy is going to help you for clearing passing your MRCOG. Okay, basically there is a structured curriculum. There is a guided preparation and consistent practice. This all is aimed at improving your success rate in MRCOG. So structured candidate friendly schedule. This is very important. Complete module wise syllabus. So always go module wise. Don't keep any module for the option. And extensive SBA practice. These are the main important features. That is how you will be helped. Okay, so well planned and realistic timetable which is designed for working doctors, clear weekly targets to maintain the consistency and momentum, then complete module wise syllabus coverage. Entire part 1 syllabus will be covered systematically. Concept based teaching align with your RCOG blueprint. No topic will be left untouched. Extensive SBA practice, regular single based answer question practice sessions will be there. Questions are framed as per the RCOG standard and focus on the improving accuracy, speed, and confidence. All these three are very important. It's not only the speed which matters. It is your accuracy of that question also matters. And always achieve the accuracy first, and then you go for the speed. Okay. So that is what is the most important thing. Okay. So generally what we do, we finish the course before the examination. At least 1 month before the examination, we finish the complete course, and then 1 month we give for the revision. So here all 14 modules we revised once again. So there is an intensive revision in which the past year's recalls are discussed, high yield topics are discussed once again, and exam patterns that also discuss. Okay, there is a flexible learning with full lecture access, because the LMS is such a planned thing that even if you miss something, it will always be there in the LMS. Okay, so all premium batch candidates will get access to the recorded lectures till your examination. Even if you miss a class, you can watch it at any time, revise at your own pace, and learn without stress. Okay, so basically, whether you are a resident or whether you are a practicing gynecologist, these are two different groups, but the goal is common. And for PG residents, it is just one subject and two examinations that I have already mentioned. Okay. So your MS-DNB plus MRCOG can go together. Your residency will continue. Prepare for university board examination. Build MRCOG concepts simultaneously. Avoid studying the same subject twice. Okay, you are studying, you need to study obstetrics and gynecology in depth only once. Okay, so and ultimately you add international qualification to your career. Even if you are a practicing obstetrician gynecologist, your clinical practice and MRCOG can go together. You continue to have your clinical work. The preparation is a flexible preparation. It is a structured learning. You can update your concepts and evidence, and you can integrate these concepts while in your clinical practice. And that is the most important thing. And you will be progressing towards an international qualification. Okay. So even if you join the course or no, but please subscribe to the YouTube channel, because there are many academic content which will be given free of cost. So this is our YouTube channel where you will get lot of MRCOG related content, postgraduate courses related content. So you should subscribe to this particular channel. And these are the free Telegram groups in which also various free activities are going on. So we have the Telegram group for part 1, part 2, and part 3. I will be giving the links in the description box also, and you can join these. Okay. And this is what is going to be the schedule. Generally, the courses will be live session will be on the weekend. Okay. We have also given more weightage to the module which carry higher weightage, like anatomy, embryology. Almost 4 5 sessions are given because they carry more weightage. Okay. So this is the way we are going to finish. All modules will be covered, and final 1 month will be for the revision, and all the sessions will be recorded session. They will be uploaded into the LMS, and you will always be able to revise this. Okay. So that finishes the topic, today's session about the MRCOG preparation. Thank you. Thank you all.